Hi, everybody. Welcome to week 4. We're going to take a look at our PowerPoints for the week. The first one we're going to take a look at is going to be government law and about policies. So we take a look at that, and we know that there's a lot of knowledge and factors that we look at when we are with the community that relate to government law and health policies. We are going to also know how government law and political action have changed over time. Knowledge and motivation to be an agent of the change in this discipline and in the community are necessary ingredients that we will have. We take a look then at our different definitions. Policy is a settled course of action, which could be a law or a practice to be followed by government or institution. We have public policy described as all governmental activities, direct or indirect. We have health policy, which is a set of course of action to obtain a desired health outcome. We have politics, which is the art of influencing others, and law, which is a system of privileges and processes by which people solve problems. We take a look at government in the U.S. healthcare. We know there's 3 branches of government: executive, legislative, and judicial. And we see the executive branch is going to be our president, along with regulatory departments and agencies such as our your Department of Health and Human Services is under our government role. The government's role in healthcare at both the state and federal level began gradually. The first major federal government action related to healthcare was in 1798 with the creation of Public Health Service. We then had the Social Security Act of 1935, which was passed to provide assistance to older adults and the unemployed. We continue on and to the Affordable Care Act, which we had discussed last class, and what that did for healthcare in the United States. When we take a look at how we have financing, we have the National Institutes of Nursing Research, and we use helpful information with policy setting and policy protection. We take a look at our Healthy People 2030 with an example of health policy guidance. So in 1979, the Surgeon General issued a report that began a 20-year focus on promoting health and preventing disease. In 89, Healthy People 2000 became a national effort with many stakeholders. Throughout the 1990s, states used Healthy People 2000 objectives to identify public health issues. We have Healthy People 2010, which focused on a vision of healthy people. And then 2020 had 4 overarching goals, and 2030 had 5. We have organizations and agencies that influence health. We have our international one, our World Health Organization. We have our federal health agencies like our U.S. Department of Health and Human Services, National Institute of Health, Centers for Medicare and Medicaid. We have our Department of Defense, we have Department of Labor, Agriculture, Justice, all are going to have an influence on our health, as well as our state and local programs coordinating efforts between health departments and counties and cities. The impact of government health and functions of the structure of nursing. We have a variety and a range of functions that we have that have a major impact on our practice of nursing. The designation of money for specific needs has led to special and more narrowed focused nursing roles, which we take a look at. The law and healthcare note, we have our constitutional law, which is going to overall guidance for selected practice situations. We have our legislation is the law that comes with the legislative branches of federal, state, or local government. Much legislation has an effect on nursing. We look at the Board of Nursing as well, our Nurse Practice Acts and what that does. Our scope of practice is seen with our Nurse Practice Act, and it involves defining nursing, its credentials, practices, and beliefs. And then we have professional negligence, or our malpractice, which we know is an act or a failure to act that leads to injury of a client. We have some legal issues, and we see it in healthcare, occupational, home care, and hospice, correctional health, some additional areas. Number and types of laws influencing healthcare are increasing. Because of this, nurses need to be involved in policy process and understand the importance of involvement in nursing. For most professional nurses, action is the policy that comes easily and naturally through participation in nursing organizations, such as the State Nursing Association and Association of Public Health. And so we really see an overlap here. Common methods of influencing health policy include face-to-face encounters, personal letters, mailgrams, electronic mail, telephone calls, through lawsuits and things like that. And they depend on the issue, whether they can be effective. Okay, so that about covers chapter 4. That's going to be our government and law with nursing. We're then going to move on to our next chapter, and I will stop sharing here and I will share another screen. All right, so here we have our faith and community nursing work in close relationship. We're going to have our parish nursing is what it's going to be called. It's faith community nursing. So we have faith community nurses that balance their knowledge and skills in the role and facilitate the faith community to become a caring place. We see faith community nursing gaining prominence. We have some different definitions that we'll look at: congregation, parish, faith communities, health ministries, spiritual care, religious care, holistic or whole person care, and we have our wellness committee or health cabinet. A recognized nursing specialty practice, but it's often overseen or overlooked. There's confusion between religious practice or religiosity and spirituality. So please be careful to be aware of your patient's spiritual needs. We have faith community nurses that establish close relationships with individuals, families. We balance knowledge and skill in the role to facilitate faith community as a caring place. When we take a look at our historical perspective, we're going to see on a historical perspective. 1984, the concept of parish nurses was introduced in churches in Chicago, and we see it as holistic health centers. We have healthcare delivery and formation of partnerships that we do. There's a lot of autonomy with our parish nursing that we see as well. So healthcare delivery systems challenged to work within parameters of tighter financial constraints while addressing complex health concerns. So we look at our federally expended automated systems like our electronic health records. To look at our continuity of care, we establish community relationships and involve. Requirements for a nurse include the following. So we're going to see an active nurse in his or her state where he practices, completion of an educational course, experience in public health. We also know that you want to be very careful with your biases with this and make sure you're aware of your own faith as well as the faith on what you're doing. Following goals for a faith community are defined in scope and standards. And we see it's the protection, promotion, optimization of health, the prevention of illness and injury. And then we have advocate for all people in the context of the values and beliefs of the congregation. Characteristics of the practice: the spiritual dimension is central to parish nursing. The roots and role practice both knowledge and skill of nursing. The services emphasize strength of health and individuals and communities. We look at personal health counseling, which we use a lot. We'll do health risk assessments, spiritual assessments, planning for healthy lifestyles, support and guidance. We look at that as well. Services to our vulnerable population as a faith nurse. I'm gonna skip that. Community nursing practice. We have models of nursing that are applied to community. We have institutional and we have congregational. So institutional is you're going to be more out in the community and having other people work with you, where congregational, you're just working with one congregation. Okay, so that's the difference between the two there. We have issues in faith community nursing, professional issues, documentation issues, legal issues, financial issues, and future growth. And to follow up, we're going to see in our Healthy People 2030, we encourage communities to cooperate and lend support to individuals and families. And we have faith communities offering an ideal setting for health promotion and long positions of esteem and influence in communities. And that about covers our parish nursing. We'll do some more detail in class this week. Our last chapter is going to be home and hospice nursing. So we'll take a look at those PowerPoints in just a moment here. All right, so we look at palliative care or parish nursing. With public health, home health, hospice, and palliative care are expanding specialties under the broad umbrella of public health. Nurses, when they practice with these specialties, we're going to use assessment, planning, intervention, and evaluation. And we'll look at a couple definitions here. For the purpose of this chapter, public health, home health, and palliative care are going to be seen as holistic services typically provided to clients of all ages. In general, public health and home health providers offer intimate, skilled, supportive care treatments so that elders and others can remain safe and avoid unnecessary hospitalization. We have hospice and palliative care services to provide comfort and meet physical, emotional, and spiritual needs. And palliative care is a wider range of services limited to days or weeks prior to the end of life and may include curative treatment. It's essential to work with the family in any of this care. We know it's a hard time for lots of families. We see it coming back from the 19th century. In the early 1900s, we have MetLife, who included home care as a benefit. That was to minimize the cost of the insurance company for those who were in a hospital. In the home is a cheaper care. We focus on primary, secondary, and tertiary interventions here. And as we do in all, home health nursing is a special area of nursing that promotes optimal health and well-being for their patients, the families, and caregivers in the home. Some home health agencies include wellness programs, health fairs, school nurses, communicable disease prevention, and other programs. We say Medicare has skilled nursing and skilled nursing services in the home. We look at the evolution of hospice and palliative care. Hospice and palliative care are similar and yet very different. So we have similarities with its holistic, evidence-based emphasis on ethics, communication skills, care coordination, focus on transition of care. And then when we take a look at our differences, we're primarily related to the reimbursement requirements in the country and the length of care and intensity of services. Palliative care is a broad term occurring over a longer period of time, and hospice is a subset. Palliative care means patient and family-centered care, optimizing quality of life, and preventing suffering. Hospice focuses on comfort for individuals and their families. Hospice is a formalized, funded program with a lot of data behind it. We see our scope and standards of practice in our ANA, scope and standards of practice. This is where we know we do have the Omaha system, which is the only ANA recognized terminology for practicing nurses in the community. The goal is to develop structured and comprehensive system that could both be understood and used by members of various disciplines. It guides our practice decisions, multidisciplinary clinical information management systems capable of meeting the needs of practitioners and managers and administrators. So positive attitude about client care is important. We need critical thinking skills. Effective care coordination requires knowing our community resources and our knowledge. We take a look at our outcome and assessment information, medication management, infection prevention. We use our evidence-based quality and performance improvement. Our legal, ethical, and financial aspects need to be familiar with the living will, power of attorney, and DNR documents, which we will go over this week in class. We have HIPAA, ethical care, and reimbursement, okay? Avoid any fraud or kickbacks with their Medicare. It's pretty regulated right now. And we have national health outcomes and our Healthy People 2030. We are also looking with home health and hospice for technology, information, and telehealth. So that covers our 3 chapters for the week. What I will tell you is we will get into much more detail during class this week. Please do your reading, and if you have any questions, feel free to reach out. Take care.